Good evening. Thank you so much for joining us this evening as we will be discussing the issue of infertility. For this month, this week especially for Nigeria has been the Nigerian Fertility Awareness Week, and we just want to show solidarity with the different organizations that are celebrating it, and as part of our social responsibility as a podcast that discusses issues that borders on sexual and reproductive health, of which infertility is a core of it. We want to talk about infertility. We want to have this conversation as it pertains to infertility, right? So if you have any questions, do well to drop it in the comment section. I will be glad to, will really be glad to hear from you. I'll also be glad, to get feedback from you and also to interact with you as we progress in this discussion and interaction. All right, so we step right straight into infertility and what infertility entails. So infertility is inability to conceive. That's for a woman, and inability to cause conception. That's for a man. So if you're unable to get pregnant, if you're unable to make somebody to get pregnant, then you're infertile. Now, it's not just about the inability to get pregnant or the inability to cause someone to be pregnant. It has to do with the inability to get pregnant or cause pregnancy when you've consistently tried. And this is not just something you come in, you do and you leave, you come in, you do and you leave. No, it's not that. It's something that you have to consistently keep trying. It's something that you have to consistently keep trying before you can say that you're infertile. So for women or for people less than 35, it is said to be when you've been trying for about a year. But if you're above 35, it is said to be when you've been trying for 6 months. That is when it can be said that you are infertile. So, what are the things that could be like possible causes of infertility? Now, we want to let you know that before this, that there are like factors. We have like basically two types of infertility: the primary and the secondary. So, the primary infertility is the one that the person has never conceived or the person has never caused conception. I've never been pregnant. I've never gotten somebody pregnant. That's a primary form of infertility. But then But then if I have tried before, maybe I've gotten someone pregnant before, but subsequently I've not been able to cause pregnancy or to get pregnant, that is a secondary form of infertility. Now, it's essential that if you've gotten pregnant, had a miscarriage, committed an abortion, as the case may be, that you need to state this out because knowing exactly which type of infertility you're currently suffering from is going to be a point and a help to your medical personnel as it pertains to how they could help you. Now, it's also important to know that medically, there are certain causes of infertility we cannot explain that. So it's possible that you go to the hospital and sometimes you're being checked out and you're being told that everything is okay with you, but you just can't find a reason why you do not conceive. This is a great possibility, a very big one for that matter. So it's essential that you know this. Also, so while we're looking at infertility, we'll talk about possible male factors of infertility. We start with the male. So majorly, the problem with infertility with a man will stem from if there's a problem with the sperm. If there's a problem with the production of sperm, obviously the problem with the sperm being able to travel. So we could have issues like low sperm count, poor sperm quality, or abnormalities in the sperm. Some sperm is supposed to have a sperm is supposed to have a head, a body, and then a tail. But then there are some sperm that have what? Two heads, two tails. Maybe some don't even have tails, some don't even have head. These are abnormalities. Now, if this happens, there's a possibility that, infertility can occur in the course of the man. If the sperm is not of the right quality, it's also a problem, right? It's not just about the quantity, it's also about the quality. Then it also has to do with the sperm count being the quantity. So you have to have the right sperm, the right quality of sperm, the right quantity of sperm, and then ensure that there's no abnormality. Very, very important. And it's a very, very serious thing for you to do, for you to understand this. Then there's issue with ejaculation. So when there are ejaculatory problems, the man cannot ejaculate sperm, or maybe there's problem with the ejaculatory duct, or any of the vesicles that has to do with the transport of sperm or semen to be ejaculated. So some people suffer from what we call retrograde ejaculation, where when they ejaculate, the semen does not come outside; it actually goes back inside, and that is a problem, right? Meanwhile, there are meanwhile there are people that are suffering from issues. Some people are suffering from issues such as um, they may have inflammation in these ejaculatory ducts. Then there's testicular problem with the testicles, and the testicle is where the sperm is produced. So if there are actually issues with the testicle, that means there will be issues likely with the quantity and the quality of the sperm, thereby it can predispose to infertility, right? As the case, it can predispose to infertility as the case may be. Now for women, we can look at problems with ovulation, irregular or absent ovulation. For example, women that have PCOS, polycystic ovarian syndrome, they have irregular, sometimes even um, absent ovulation. That in itself is also a problem. That in itself is a problem that can lead to infertility. Issues with the uterus, the uterine issues, fibroid, polyps, scarring, adhesions, as the case may be. All of this can play in the long run into becoming an issue as it pertains to fertility. Issues with the fallopian tube, whether the fallopian tube is blocked or whether it's damaged mostly due to pelvic inflammatory disease, PID, that can also be a problem. Then we have age-related decline in fertility. When a woman crosses the threshold of 35 years, the quality of our egg begins to go down. So this affects her altogether, as the case may be. So it's essential that women cater to these, and women actually think about this and look at this. Now, even this age decline fertility also affects men, especially when men get to 40 and above. So we have andropause, the quantity and the quality of the sperm start to change as a as the case may be, right? So that is an issue. So let's look at lifestyle issue. The life you live, the kind of lifestyle you put up may become a problem in the long run as it pertains to fertility. Now, smoking and alcohol consumption, it's one of the major problems, especially for men. In fact, if for the next and for the new episode that will be posted, that will be going live later this evening, we had a fertility specialist come to speak. You realize that if you are suffering with fertility issues, one of the first things they ask you to do is to cut off alcohol and smoking, male, female, as the case may be. It's very, very essential that you do cut it off. So that could be a problem. Then we have the issue of obesity. Now, obesity plays in the long run into every other thing that affects the person. So it's essential that you look at your weight. Because your weight can affect your hormonal level, can affect how much hormones is produced, as the case may be. Then we also have stress, whether emotional or psychological stress. This also this also can be this also can be a problem. So how do we diagnose infertility? Like I said, you must have been trying. Like I said, you you should, and you must have been trying for a particular number of times. If you are above 35, you must have been trying for 6 months before you can say that you're infertile. If then, if then you are, if then you are less than 35, you must be trying for a year, consistent unprotected sex. That is the first thing that needs. Then there will be other comprehensive evaluation. They will talk about your medical history. There will be physical exams, abdominal pelvic scan, semen analysis, hormone profiling. There will be different tests that the medical professionals will put in place to ensure that they check if everything is okay as it should be. Right. So it's essential that you look at this and that you know this. Now, when this has been assessed and this decide the kind of treatment option you need to go through. Now, I was speaking to a community, I think that was yesterday, and some women who are trying to conceive were asking questions. There's this thing among women who are trying to conceive. In fact, it's a general issue in medical science that when I have a similar diagnosis or problem, I tend to want to take medication from someone that has similar problems. So a woman came in that she's finding hard to conceive, that a friend of mine recommended a particular drug. And I told her, and the thing with the drug is that the drug helps to boost ovulation. Now, like I said before, as a woman, there are so many things that could be the cause of your infertility. So, like I explained to them, you don't just take treatment because you want to take treatment. Know the cause of your own problem. Yes, everything is infertility or you're finding hard to conceive. But then infertility can be due to ovarian issue, can be due to chip issues, can be due to uterine issue. A drug or a treatment regimen for somebody that is having issues with the ovaries is different from somebody having issues with the chip, or somebody having issues with the uterus, or somebody having issues with resource incompatibility, for example, right? So it's very, very essential that people know this. So you don't just go and take treatment option because you want to take treatment. Treatment is due to what has been diagnosed, what is essentially the underlying cause, if identified, of your infertility. Is it ovulatory problems? Then you'll be given treatment to boost ovulation, or as the case may be. Do you need to do a surgery with PCOS? Do you need to do surgery to remove ovarian cysts? Is it a tube issue? Is it adhesion of the tube or blockage of the tube? Is there surgery to, unblock the tube as the case may be? Is it uterine polyps, fibroid as the case may be? All of these things. So it's essential that you know exactly what is the cause. And because of this, there are different treatment options, various treatment options as the case may be for infertility. Very, very essential that you know this, that there are different treatment options. So then, what are the treatment options? Okay, before then, let's look at the signs and symptoms of infertility. So it would differ. So the first thing is for you to know that you're unable to get pregnant. In fact, that's the major sign. But then, if you're having pelvic and abdominal pain, if you're having irregular periods, if you're having irregular vaginal bleeding, if you're having penile disorders, or you're having issues with ejaculation, these could be subtle pointers that infertility is around the corner. Infertility may happen, right, as the case may be, right? So statistically, we're looking at 33% of the causes of infertility is from the side of the woman, 33% from the side of the man. Then we have the part that is unexplained. So the remaining part becomes like unexplained, right? But then things like age is implicated. Like I said, the older you go, as you cross the threshold, for a woman as you cross the age 35 threshold, for a man as you cross the age 40 threshold, it becomes harder to conceive or to get somebody pregnant, as the case may be. So the same thing with eating disorders. If you have eating disorder, which may predispose you to obesity, it becomes a problem. If you have issues with alcohol and smoking, that's a problem. If you're exposed to environmental toxins, we're working in places, you're exposed to lead, pesticides, some of these toxins interact with the body and become a problem. They become a problem. So that's something that we should know. Now, if you over exercise, now especially for ladies, if you over exercise, testosterone is produced when you exercise. So if you over exercise, there may be an increased buildup of testosterone, which is an androgen, a male sexual hormone. And if this male sexual hormone builds up, it means that it will affect your female hormone and may affect your reproduction. Sexually transmitted infection also play in as a risk factor, especially untreated sexually transmitted infection, which may lead to pelvic inflammatory disease that is affecting your organs, that can be affecting your organs as the case may be. Then I've talked about substance, I've talked about hard drugs and the rest, and I've talked about being obese. And it's not just obesity, if you're also underweight is a problem. If you're underweight is a problem, right? Because some of these hormones has to be synthesized with the fat in your body. So if you do not have a good amount of fat, it may become a problem for you. So it's essential that you look at yourself and you know what is okay with you. Now, there are also risk factors for women. So we're looking at risk factors like structural abnormalities. Your uterus is not positioned like it should. There is issue with your vaginal fallopian tube. It could be a problem. Polycystic ovarian syndrome, I already mentioned it. Ovarian insufficiency, where you have poor air quality. It is a problem. Sickle cell anemia could be a problem. Fibroid is also a problem. Chromosomal disorder and genetic disorder is also a problem. as the case may be. So you need to. It's important that you. It's important that you look out for these things. Yeah, so it's important that you look out for this thing. Okay, so for management, first thing is let's look at for women, how do you manage it? First is the lifestyle modification. So if you're gaining weight or losing weight, there may be a need for you to gain weight or lose weight. If you're underweight, you may need to gain. If you're overweight, you may need to lose. Then there are medication, drugs to stimulate ovulation, if that was the cause, or to increase your chances of getting pregnant. Sometimes it's surgery, if it's like low fallopian tube or issues with the uterus. Surgery may be needed, to clear the space. Now for men, there are medication to boost testosterone level. There are medication for erectile dysfunction. There are medication to help with the sperm quality. Then there's also surgery in case you're having blockages of tube. I talked about ejaculatory dysfunction, where the tubes are blocked and the sperm doesn't come out as it's supposed to come out. So that is how it is supposed to be. Now, on the flip side, we have the in vitro fertilization. If there is infertility, especially those that the cause cannot be ascertained, or maybe the cause cannot be treated, you may opt for in vitro fertilization, where egg is released and egg is gotten from the woman, sperm is gotten from the man, and then fertility is done outside the body and then transferred to the woman's body. Or sometimes we have intracytoplasmic sperm injection, right, where a sperm is injected into an egg, or intrauterine insemination, where a tube is used to place egg directly in the uterus. Or maybe third-party ART, that's assisted reproductive technology like donor sperm, donor egg, or surrogacy. These are things that you will learn from our episode that is dropping this evening, where we talk about assisted reproductive technology. So, what are possible complications? There could be complications during treatment. Like if you undergo fertility treatment, there's a higher chance of having multiple babies. I'm talking about twins, triplets, or more. Then there's a chance of what we call ovarian hyperstimulation syndrome. So most times, because of the stimulation of the ovaries, it may become painful and swollen. Also, there may be risks of ectopic pregnancy, as the case may be. So fertility can be cured depending on the cause, right? So lifestyle modification, medication, assisted reproductive technology should take care of infertility. So what I want you to do is that for you to know that infertility is not the end. There are technologies now that could help you. It's important that you, not just you, because I know the burden of infertility is always placed on the woman. You, the woman, and also your spouse, go and get yourself checked out. It's quite essential that you and your spouse go get yourself checked out. And if you checked out, there's a likelihood that the earlier it's diagnosed, the better the prognosis. So we're here to just discuss. We're here to just discuss about infertility to celebrate the Nigerian Week Fertility Awareness Week, Nigerian Fertility Awareness Week. Um, we're wishing you love and light for everybody who's struggling with infertility. If you have any question, please drop it in the comment section. We'll be glad to answer your question. And do not forget to watch our episode that is coming up this evening. It's about infertility, it's about assisted reproductive technology. It's insightful, it's inspiring. You have a lot to learn. Thank you so much, everyone, for joining. Thank you for spending the better part of almost 20 minutes with me. I am the host of the Intimate Masters podcast, Nurse Akwaopa, also called the Geek Nurse, and we're here to share about infertility. Thank you for joining. And until we come your way next time, I want to say bye for now.